In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There is also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
COVID-19, coronavirus, is a respiratory illness transmitted from person to person through droplets from an infected person sneezing or coughing. People catch the virus from contact with the droplets. Close contact includes having been within 2 meters of a confirmed case for at least 15 minutes or living in the same household as a confirmed case. COVID-19 can also be transmitted through touching a surface that has the virus on it and then touching your own mouth, nose, or eyes. The best way to prevent COVID-19 is to practice good hygiene. Good hygiene includes washing your hands frequently with soap and water. This is just as effective as using hand sanitizer. Cover your mouth and nose when coughing and sneezing, and discard the tissue immediately into a bin and wash your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Leave at least 1 meter, 3 feet, distance between yourself and other people, particularly those who are coughing, sneezing, and have a fever. The use of a face mask is not required, and there is no evidence to suggest that it protects people who are well. For more information on the COVID-19 coronavirus, please visit www.hse.ie.
The majority of transmission that we know about is that people who have symptoms transmit the virus to other people through infectious droplets. But there are a subset of people who don't develop symptoms. And to truly understand how many people don't have symptoms, we don't actually have that answer yet. So when we say asymptomatic, we mean somebody that does not have symptoms and does not go on to develop symptoms. Truly no symptoms. We know a number of them who are reported as asymptomatic actually may have mild disease. They may go on to develop symptoms. They may not quite register that I'm sick. I just feel a little bit unwell. I'm just a little bit under the weather. I'm feeling a little bit fatigued. And some of those individuals we would classify as pre-symptomatic, which means they have not yet developed symptoms. We know from some of the viral shedding studies from some of the lab work that there are people who are infected with COVID-19 that can be PCR positive, that can test positive 1 to 3 days before they develop symptoms. And that's something that we've known for quite some time now. What we need to better understand, and this is one of the major unknowns, is what proportion is contributing to transmission.
When you sing or you're shouting in a nightclub because you can't hear your friend and you're saying, can you hear me? And you're close by and you're projecting your voice at someone, then it's clear that in that situation, if the virus is present in your upper respiratory mucosa, then there's every likelihood that you can project that virus. The last couple of days have been the highest number of daily cases in the world. So in terms of pandemic generation, we are still very much on the upward climb on this mountain. But what some countries have shown, many countries have shown, is if you go at this in a very systematic way and you use a comprehensive approach, that there is enough stoppability in the virus. We've seen that with physical measures, social distancing. We've seen it with surveillance, and we have some choices to make as a society, because it is clear if we can identify cases and their contacts, and we ask those contacts to quarantine themselves, and we support them in that quarantine, that can be a very successful way of both stopping the disease and avoiding large-scale lockdowns in future.
How to safely wear a face covering. Wash your hands well with soap and water before putting it on. Without touching the front, put it on so that it covers your nose and mouth. It should go right over your nose and the bottom of your chin. Hook or tie the covering straps so that it fits closely and well to your face. Avoid touching your eyes, nose, and mouth at all times. Take the covering off from behind. Store it in a plastic bag until it can be washed. Once it is off, wash your hands well with soap and water. This is very important. Wash your covering regularly with normal detergent in a normal wash. Don't forget, a face covering may help prevent people who do not know they have the virus from spreading it to others. It is not a replacement for washing your hands or keeping the 2-meter distance.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.